Okay. All right. So a little bit of difficulty getting started today. So again, welcome to my stream on Thursday nights at 7 p.m. Really appreciate you all tuning in. As I said here, today is a very cold day in Texas. So we have very icy conditions. Most people stayed indoors because it really is very icy out there. And in Texas, we don't really have the infrastructure where roads are continuously de-iced, and so most people did stay at home. But there were a few accidents in the morning, and definitely it chills you to your bone. It's I think in the high 20s, I want to say. So this is not really cold weather for those of you up in the north, but for those of us who live mostly in the 90s and sometimes in the hundreds, this is extremely freezing. So that's what's going on in Austin, Texas today. So we have several things we want to talk about. One of the big pieces of legislation that unfortunately did not get a vote yesterday, which was instrumental to getting single-payer healthcare coverage, was the California Universal Healthcare Bill, also known as CalCare. So we'll talk a little bit about what happened and why that failed, and I'll share some stories with you to shed some more light, because I think this is really important for those of us who believe in single-payer healthcare. As you know, I'm a staunch supporter of it. We'll talk a little bit about what's going on in Texas, still rejecting mail-in ballot applications, and why that's happening here in Texas. And when the GOP comes out and says over and over again, we're not making it hard to vote, you be the decision maker here. I'll tell you exactly what's happening, and you can decide whether it's any easier at all. And then unfortunately, we will talk about what is going on with Build Back Better, which doesn't seem to be much. This is extremely unfortunate because these are the types of things that Democrats came out in 2020 in a big way to give Democrats a trifecta in Washington, D.C., a slim majority in the House, a very slim majority of one vote by the VP in the Senate, and of course, President Biden in the White House. But it doesn't seem like items in the Build Back Better that would really benefit American families, working families, have any chance of passing, at least not in the near future. And then I'll give you a quick campaign update on what's going on. Of course, we're right up against a huge deadline here. We're coming up right against the final primary date when this election will conclude in many ways. At least a primary election for sure. So first of all, let's talk about what happened with CalCare. And the first thing that I wanted to bring you to is this article by NPR, California Universal Healthcare Dies Without a Vote. So you may be asking, if California has supermajorities of Democrats, why did it die without a vote? So let's go and actually look at this article, because I think it's important for us to read this together. So one of the things you'll see here is an interesting part of this debate is cost, right? It says here, debate about the bill had been dominated by costs, okay? A study of a 2017 proposal in California estimated that it would cost $331 billion, which is about $356 billion today when adjusted for inflation. So they're talking about the study that was done in 2017. We're now in 2022. So technically, almost 5 years later, the cost would be about $356 billion. So that is the problem with the cost. But here's the funny part. So California is on pace to spend $517 billion on healthcare in 2022, according to an analysis by a commission established by Governor Gavin Newsom, who's the current governor there, to study universal healthcare. The largest chunk of that is from employers and household, followed by the federal government. So they're comparing this to California's total operating budget of how much it is. But here's the interesting thing. If you are fighting and debating about the bill, which is dominated by costs, and we're on pace to spend $570 billion, then it begs the question why you wouldn't want to spend almost, not quite $200 billion, but definitely much cheaper. $356 billion, last I checked, is lower than $517 billion. Now, I want you to keep this in mind as we talk about this and go forward. So one of the person that in the California legislator that brought this bill, his name is Ash Kalra. So let's talk about what he said about that, and let's go to that. So there's a little quote from him. This is a quote unquote from Assembly Member Ash Kalra. So he says, "I don't believe it would have served the cause of getting single payer done by having the vote and having it go down in flames and further alienating members." He said in a Zoom call with disappointed supporters later in the evening, in which he shared that he believed the bill, which needed 41 votes to pass, was short by double digits. So what he's trying to say here is that it doesn't have the votes to pass, and it would alienate members, meaning it would put them on the spot in terms of it becoming a reality that they are not voting for it. And so, when you put a bill in front of people to vote, you know exactly where they are. Because here's the thing, you have people who are going to Congress that are making all kinds of promises and that are saying, hey, we've been working on this forever and ever and forever, and we just can't do it because Senator Manchin or because Senator, Sinema. And every single time we have the ability to pass a bill, it seems like there is a reason that we can't get it through, right? So it's very easy for Congress people or even, assembly members, state senators, state reps to make these promises that they will co-sponsor bills, and they will even co-sponsor bills. They will join caucuses that support these types of bills. But when it really comes down to voting, they may not be willing to vote. And in order to not alienate them, a lot of times they will not bring it to vote. So now I want to go back to this article, which says, right after, the nurses are especially outraged that Assembly Member Ash Kalra is who they're referring to, chose to just give up on patients across the state. Nurses never give up on our patients, and we will keep fighting with our allies in the grassroots movement. So I wanted to go in and look at exactly what they were saying. And you can see here the National Nurses United, they condemned the California Assembly for giving up on a bill that would guarantee healthcare in the state. And you can see here, there's an article here saying that they condemned future elected representatives that are putting patients above profits. Now, there are, of course, a lot of speculation out there that there are, of course, corporations involved in this. Most importantly, I think it's important to talk about this because we do have, health insurance companies that are very much entrenched into our system of healthcare that are making billions of dollars in profits. So, of course, if it goes to single-payer healthcare, that would become a challenge. But I want to talk about some of the challenges that people bring up as to why this cannot be done, and I want to debunk those issues right there. So let's go back to that, and there's three things that we talk about. One is when many people will talk about healthcare is a human right, and then they'll follow that up with the second line saying we need to increase access to healthcare instead of talking about coverage, just covering every single person in the United States. Because here's the truth of the matter. People say that healthcare is a human right, but the fact is if you don't have your health, you have nothing. I would often ask people when I talk to them, when I talk to voters in my district, what is the most important thing in your life? And they often say something like, my children or my family is the most important thing. It's a very common answer. And I always love to say, it's actually your health. Because if you're not in good health, you can't get up in the morning and make lunch for your kids. You can't love your family. You're not there for them. You can't be there for them the way you could if you were in good health. So, somebody came up with a better answer. So one time I asked somebody, what is the most important thing in your life? And that person said, life. Life is the most important thing in our life. And of course, we can't live a fully complete life unless we have good health. And we can't have good health unless we focus on getting preventative care, primary care, being able to go visit the doctor when we are sick. So that is also a big important part of being able to get health care. So this wording about access versus coverage, we often hear people in Congress talk about, hey, we want to improve the access. So let's expand, for example, the ability to get healthcare through the Affordable Care Act. And the Affordable Care Act, what it does is it pays these premiums to health insurance companies that are subsidized by the United States government. So what it really does is it entrenches the health insurance companies further. They're guaranteed a certain amount of money, no matter whether you ever go see the doctor or not. So that is the premium that you pay monthly. So let's say you pay, I'll make it up, $400 a month. The health insurance company is guaranteed that $400 a month, whether you ever go see the doctor at all, right? Number one. Number two, there is a deductible that almost all of us, if not all of us, have to overcome in order for our health insurance to actually kick in. So that amount of money, which often runs in the thousands of dollars. In Austin, Texas area, it's often $7,000 to $8,000, is also guaranteed to the health insurance companies, even if you're going to see a primary care physician or just a specialist for a checkup, etc. That doesn't the amount of money that the insurance company gives does not kick in until you have met your deductible. So it's really important to talk about coverage versus access and to point out to our politicians that, hey, when you talk about access, you're actually entrenching insurance companies more. The second thing that I want to talk about is sponsoring bills versus passing bills. It is really great to have Congress people say, hey, I, for example, have co-sponsored Medicare-for-all, right? But sponsoring a bill, which we saw, does not help get things done to deliver to the American people. So a lot of Congress people will say, I support Medicare for all, and if it came up for a vote, I would vote for it. Well, in California, it was supposed to come up for a vote. And there are many people that support single-payer healthcare in California. Specifically, you saw the nurses, etc. And so it is a question for all of us as American citizens. Is sponsoring a bill enough? If it's not coming up for a vote, for example, in California, where it was dropped, and is not actually voted on to see how people vote for it, then no one really has to commit to it. All they have to do is say, I support it, I'd vote for it if it came up, but it never becomes a reality for the American people. And then the last thing that I want to bring up, which I showed you in this article, it's really important, is the cost of healthcare. You'll see over and over again, we talk about free healthcare, or we talk about, oh, it costs so much, so you can't get it. But you saw right there when I showed you in this article, right, that I showed you 1 second ago, is when they talk about the cost of healthcare, they're saying that universal healthcare would actually be cheaper. $356 billion today versus being able to spend something like $517 billion. So you can see it's very clear that when they talk about the cost and they say, hey, your insurance, your taxes will go up. The truth is that your taxes cannot go up if the cost is lower than what you would be paying anyway. So that is a really important concept when people say things like, well, if you get single-payer healthcare, your cost of healthcare, the taxes you pay will go up. How is that possible if we're paying 4.2 or $4.1 trillion for healthcare right now, and single-payer healthcare would cost something around $2 trillion or less? It is impossible for it to cost more, or you paying more taxes. You're already paying this, whether it's pre-tax or post-tax, you're already overpaying for it. The truth is we're being gouged on healthcare, and this whole California ordeal makes it very clear that politicians alone are not going to make this happen. We must come together as individuals and hold our leadership accountable, because just co-sponsoring bills is not enough. It does not deliver for the American people. So with that, let's talk a little bit about Texas and what's going on. Now, I have already talked a little bit about hundreds of mail-in ballot applications that were being rejected in Texas. And I wanted to give you a quick update on what really is going on and why this is happening. So here's an article that came out just a couple of days ago here on January 24th, and you can see that hundreds of applications are still being rejected. And the reason that they're being rejected is very simple. Earlier in 2021, there was a bill that was signed into law by Greg Abbott. It's known as Senate Bill 1, and it contained an array of new restrictions on the state's voting process and narrowed local control of elections. This is important because the GOP is very focused on talking about local control. We don't want the federal government in our state's affairs, but here the Texas Tribune is specifically reporting that it narrowed control of elections by local officials. One of the most interesting things is that voters are now required to include a state ID number, like a driver's license or a partial social security number, the last 4 digits of your social, on your applications for a mail-in ballot. But here is the reason that they're being rejected. Those numbers must match information in a voter's record, or their application will be rejected. This voter's record is the ID number that they use when they register to vote. And so because in Texas, every single voter must submit new applications every single year. Okay, so you can't register to vote online in Texas, and you must mail in a application every single year. This is a physical piece of paper that you have to print out, fill out, sign, mail it in with a stamp. So this is why hundreds of applications were basically missing, because they're missing the ID number, which doesn't match the number that they originally, for example, registered to vote for. Now, the Secretary of State's office has been working to backfill its records to include both driver's license numbers and social security numbers for most voters. But various Texas counties, including some of the largest, did not know they were supposed to check the state's database along with their own when trying to validate the application. So what counties like Travis County here in Austin, Texas were doing, they did not have driver's license numbers in their own app, or they didn't have the ability to check, and they did not know they were supposed to check the state's database. And in many cases, for example, they did not know that they would have to go beyond their internal systems, right? And this is talking about Williamson County. This is North Austin and North Austin suburbs, Williamson County. So this discrepancy, right, helped drive an initial 50% rejection rate of applications in Travis County, right? Vast majority of which officials attributed to the new rules, and this rejection rate dropped to 27% in Travis County. But you can see this is still ongoing, and this issue is not definitely over just yet. So they created a law where they want you to remember, even if you voted 10 years ago, 15 years ago, even if you registered to vote a month ago, like, did I use my driver's license or did I use my social security number? Whatever those 4 that you use have to match, and that's why they continue to be rejected as of today. And of course, that makes it more difficult, specifically on people who are 65 and older, people who have disabilities, and those are the people that are actually even allowed to vote by mail, including people who are going to be absent the entire time that voting is going on in Texas, which is a small percentage of people. So the folks that need help the most are the ones having the most difficulty being able to do mail-in voting. So with that, let's talk about what is going on with Build Back Better. As you know, the last half of 2021, I brought to you specifics of the Build Back Better, the parts that I liked very much, the parts that were gutted, and I want to revisit this. So this is from, I guess, 2 days ago on February 1st. Build Back Better is dead, according to Senator Manchin. And so we'll go look at the article in 1 second. But before we look at the article, what I do want to show you is what was originally in Build Back Better. So these were some of the key items in Build Back Better. And of course, the red items were gutted. Majority of those red items were gutted in the House before they even made it to the Senate. Immigration was something that was talked about in the Senate, but when you talk about Medicare expansion to include dental and vision, it was gutted in the House. Remember, we have a majority in the House, a slim majority of only 3 people, but it was gutted in the House. Lowering the prescription drug prices, gutted in the House. It was a bill that only covered certain medication, etc. Even though it did have some provisions there for insulin, which is very much needed. Again, majority of it was gutted in the House. Paid leave, 12 weeks, gutted in the House. Tuition-free community college, my favorite item, gutted in the House. And of course, now that Build Back Better is essentially dead, universal pre-K, child tax credits, climate mitigation, all are off the table. This is obviously not just devastating, but it's extremely difficult. But let's look at this article that says, Manchin says Build Back Better is dead. Here's what he may resurrect. So they talk about things here that he may be for in this article. And he's talking about, what are the things that he may support. And he talks about, clean energy. Yes, we basically believe, yes, we can maybe do something, he says. Here's the thing that really stands out to me, more subsidies for the Affordable Care Act. So remember, we just talked about more subsidies for the Affordable Care Act. Again, that is a straight up payment directly to insurance companies from the United States government that delivers nothing. These subsidies are your premium payments that you get nothing for. You get a physical checkup annually because of these premiums. And if you aren't able to afford them, in majority of the states where they have expanded Medicaid, you would be able to get these premiums, majority of those premiums covered, but it entrenches healthcare companies, health insurance companies, versus actually getting healthcare to people. So they're talking about anything that helps working people able to buy insurance that is affordable. So the strategy here is not to deliver healthcare, but to allow you to buy insurance. Whether that insurance actually covers you, whether you're able to go see a doctor or not, that does not seem to be the focus of being able to expand or give access, quote unquote, access to healthcare. And of course, he's talking about extending states that limit Medicaid, right? Again, wants to expand Medicaid. Texas is one of the states that did not expand Medicaid, leaving out, millions of people. We're number one state with the most number of people with no health insurance, most number of people with no health care, and of course, number one, rural hospital closures. There's another thing that's been talked about is that now they want to basically, put the, last nail in the coffin for Build Back Better, and they're possibly looking for a new name. The challenge with coming up with a new name is not so much that it's a good way to sell it. The challenge is all these things that you see right here. Those are those going to be in that new bill or not? And I think that's the biggest challenge that we face as a community, that Democrats, when we came out in 2020 to make a big impact and to really ensure that the Senate had at least 50 Democratic senators, unfortunately this is not happening. But what's most disappointing is that even with a majority, even if a slim majority in the House, that majority of these things have not been accomplished. So you can pass bills in the House all day long. That does not help the American people. That does not deliver for the American people. You have to write bills in the House that you can negotiate with senators and actually get passed to get things done. Remember, the child tax credits, gone. We talked about lowering the poverty and making sure that children have enough to eat in this country. Starting January, they vanished. So this is the state of our country right now. And I want you to understand why it is so important to participate in primary elections. And before we conclude today, I want to talk a little bit about our race here in Texas. Texas has a very early primary. Texas gained 2 new U.S. congressional seats in 2022 for the 2022 election. So back in 2020, we had 36 U.S. congressional members that went from Texas to represent Texans in Washington, D.C. And we've added 2, so we now have 38. I think we're the only state that added 2 new U.S. congressional members. Now, Austin, Texas, for the first time in decades, got a brand new district. Prior to that, Austin was sliced up into 6 pieces and gerrymandered severely. Of those 6 pieces, 5 of them were represented by extreme right-wing GOP members that had policy focuses or platforms that did not align with the people who live in Austin, Texas. So for the first time in decades, Austin has the opportunity to send a new representative that will champion single-payer Medicare-for-all, scale the healthcare infrastructure with more nurses and doctors, and eliminate student loan debt. But not only do that, but ensure that we have debt-free education. And these are the focuses of my campaign here in Austin, Texas. Our primary starts on February 14th. And as of Texas Tribune's reporting, 57% of the people in Texas voted early in 2020. So majority of the people vote early, which means majority of the people that we need to reach has to happen before February 14th. It is extremely important. So as you know, I'm extremely involved in my campaign. I also canvass and talk to voters. It's one of the most favorite things I do. And this weekend, when I was canvassing and knocking on doors and actually having conversations with people, I expected there to be some, indifference or kind of not as much engagement because we're in a midterm, of course. But I was quite shocked that majority of the people that I spoke to were not aware that there was a Democratic primary going on, and they weren't aware that it started on February 15th. Part of the reason is that if you lived in any of these 5, actually even 6, all the 6 districts that run to Austin, especially if you lived on those 5 gerrymandered red districts, you probably never had a Democratic primary to come out for, because it was so red, we didn't have Democrats to run majority of the time. So voting in a Democratic primary wasn't always a big thing or a regular thing. So majority of the people probably didn't vote in a Democratic primary. So that's number 1. Number 2 is that if you have a very strong blue-leaning district, and you have an incumbent there, usually there's not a major primary. And in many cases, they have there is no primary. So people do not regularly come out in a primary election. However, because this is a gerrymandered blue-leaning district, it's almost surely true that the representative of Austin will be decided in the Democratic primary. That is why this primary is so important, because people in Austin, Texas haven't had the opportunity to put in somebody that really aligns with their values. So that's what's going on. I spent the weekend knocking on doors. So if you're watching this on Twitter and you're in Austin, please, let your friends and family and coworkers know that there is a primary going on, that this race will probably or most certainly be decided in the Democratic primary. So if people don't normally vote, independents and people who normally don't vote in primaries, this is the time to come out and vote in the Democratic primary if you want to have a real impact. The second item that I want to bring to your attention is that primaries have very low voter turnout, typically less than 20%. In some cases, close to 10 or 15%. So if you're, for example, a minority voter, for example, Black Americans or Asian Americans, and you come out in the primary, your vote all of a sudden has a tremendous impact because there are so fewer people voting. In fact, it doesn't matter who you are. If you come out in a primary, your vote has just a bigger impact because of the percentage of people that come out. So not only do primary voters make very important decisions for the district with respect to who gets the party nomination, but in many cases, in gerrymandered districts, they make the decision. A very small percentage of people are making the decision of who should represent us in Congress, or even at the state level, or even at the state rep or state senate level. So this is a really important thing. If you have a chance to explain to other voters, please do. And of course, if you're outside of Austin, Texas, please consider, telling your friends, if you know anybody in Austin, Texas, coworkers, friends, family, to come out and vote on February 14th during early voting between February 14th and February 25th. And of course, Election Day is March 1st. So with that, I want to thank you for joining my stream today. Sorry for the little hiccup during the start, but I hope you have a wonderful rest of the week. And if you're watching from Austin, I hope you're nice and warm and toasty. And I'll see you again next Thursday.